Thank you very much, Cynthia, and thank you for having me here today. And as Cynthia pointed out, the Health Council of East Central Florida is located in Oviedo. We're on Aloma, and I do live here in Winter Springs, so it's nice to join you and be here today. Cynthia asked me to do an overview of what's going on, and I think we would all agree that we really do have a real mess in healthcare, very high costs, access problems, quality issues, and quite a bit of health disparity when you start looking at racial and ethnic and age groups, when you look at different data points. But we continue to hear we have this excellent healthcare system, and the reality of it is when you look at our life expectancy, we rank at 24th in the world as far as having the best health. And on some indicators, like infant mortality, we're down a lot farther on that list, and we're very similar to developing nations on certain measures. So certainly there's room for improvement, and I think we would agree that our system is broken and needs to be fixed. Within the United States, unfortunately, Florida ranks at the bottom whenever we see these polls. You probably see them in the Sentinel and other papers. Good news, Seminole County within Florida does tend to have a higher health status than the other counties, but we are, in the last couple of years, really seeing that slip as population's aging, and we certainly heard some good data on that. But also we have increasing diversity in Seminole County from a socioeconomic standpoint and other measures. So we really are holding on as hard as we can to a really good health status in Seminole County. We've been collecting a lot of data. That's what our office does. We've got at least 1 in 5 Seminole County residents who are completely uninsured right now, and the number's growing. We get calls in our office every day from people who've lost their jobs, lost their coverage, they have chronic conditions, they've got their last diabetes pill in hand. What do they do? Where do they go? Very desperate situation for a lot of people, and you probably know that bankruptcy, homelessness, one of the contributing factors to that is very high medical costs. So we're hearing lots of very, very scary and sad stories every day here in Seminole County. We're really fortunate that we have an excellent health department. We have an excellent community health center, great hospitals. We have a volunteer physician network. They see lots of patients for free. We have a compassionate drug program where we can access free meds for the poor and uninsured, but we cannot keep up in Seminole County with this demand. And so what happens, and I see lots of hospital partners here today, when folks can't access care in the community, they use the emergency room, probably inappropriately, for primary care, and you probably already know that the costs associated with that are shifted to insured patients and businesses. And so as this economic downturn continues, the pressure and the exacerbation of this problem gets worse for Seminole County. Our hospital partners have shared with us a bit of a shift. It used to be all their bad debt was largely uninsured. And what we're seeing now, one of the local hospital partners said 65% of their bad debt is actually people who are insured but can't afford their copays and deductibles. So that's another story. We have the uninsured, and then we have people who are insured that aren't able to pay those out-of-pocket costs. So that's a trend that is of concern as well. Health Council does a community health survey every 5 years. We did in 1999, 2004, 2009, and we look at health access, health behaviors, and also what conditions the people in our community are living with. And as I said, Seminole County had really been doing marvelously well for years, but we have higher levels in this last iteration here of depression, hypertension, high blood cholesterol, diabetes, adult asthma, overweight and obesity, and skin cancer. So we're also hearing that the cost of medications and the cost of doctor's visits have prevented probably about 20% of our residents from accessing the care they need in the last year. Just accessing affordable care is not going to make us healthier in the United States, though. So when we're looking at, healthcare reform, I feel like there's a piece missing in here. There's been research that's been done that says really only probably 10 to 15% of the improvements we've had in our lifespan over all these years are due to access to high-quality healthcare services, only 10 to 15%. The other factors are your genetics, and that's probably about 15 to 20%, so you can't get around what you inherited from your parents. 25 to 30% is your environment. Do we have good water, good air, good housing? Are the roads safe? What really is impacting health, 40 to 50%, is your health behaviors, your lifestyle. And so as a whole, we're not eating all the right foods in the right quantities, we're not getting enough exercise, but there's a lot of risky behaviors going on. We still have people smoking, we still have people who don't buckle up, we have actually a lot of people with unprotected sex, and all of those behaviors, those risky behaviors, take years off of our lives. Right now, the country is paying $2.5 trillion a year in health care, and only 3% of that is on prevention and education. The rest of that is all on treating disease and injuries. So I kind of feel like it's not a health care system, it's a sick care system right now. And you've probably heard of late some debate on whether prevention and education make a difference. And it really does. They find that a dollar spent on the front end on prevention and education can save $8 and $10 in later healthcare costs. So what I'm leading up to is I really think we need a more balanced approach to healthcare reform than is currently on the table. Right now we're looking at insurance changes, but we aren't looking at individual accountability and personal responsibility. People do not know what they need to be eating, doing. They're confused. We get all kinds of weird research studies out that say chocolate's good for you, bad for you, wine's good for you, bad for you. You've all seen them. You don't know you don't even know whether you're supposed to have it or not on any given day. And I have a little cartoon in my office, and it's a health news reporter, and behind him are 3 wheels, and you spin them, and it's like chocolate, white wine, exercise is good, bad, does affect, doesn't affect your heart, liver disease. And that's kind of what it feels like for people on any given day. They're confused, and they really don't know what to do. I would like to see in healthcare reform some kind of incentives, some kind of rewarding for healthy behaviors. Some businesses have done that, and they've already seen some real improvements in that. I think that's what's going to move the needle on the cost of healthcare and also move it on the health status. I don't personally have any real problems with the ideas and the concepts that are in the healthcare reform bill, but I don't think there's near enough detail for us to really understand how it's going to work and how it's going to be paid for. So though there's such an urgency to get healthcare reform underway, I do think that we need to take some time and really explain to people what the impact is going to be. Just while Congress is in recess this month, 25,000 more Floridians will lose their health care coverage in that short period of time. So again, that balance of taking the time to understand what's going on and being able to address a very, very urgent problem is a tough mix. So that's my overview.
Thank you. Dave, how about you?
Well, fortunately or unfortunately, I was told about an hour ago that I had to be here, so you'll have the benefit of me yielding some time. But essentially, there's a lot of, a great deal of truth in what was just said with regard to the wellness of the individual or their personal responsibility. That's huge. We're being compared to life expectancy from other countries, and the cultures are just totally different. So there's a lot of that weighing on it. So one of the things that, we do at Blue Cross and Blue Shield is we have wellness initiatives that we also put into our groups, training, education, and making aware of chronic diseases and things like that. It's a personal responsibility to take part in your health care itself. You have to understand what it is that's ailing you. You have to understand your medications, learn how to say the medications, take personal responsibility to understand health care. Blue Cross and Blue Shield, just briefly, not-for-profit mutual company, domiciled in Florida. We're here for Floridians. We're trying to do the best thing that we can to match it for the monies that are available and the cost of health care. We need help. We need your help to do that personal responsibility aspect of it, and take a look at yourself. Understand health care. Understand health insurance. Understand the financing of health care. Those are the things that we can do together and understand the programs that are out there today.